Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal RX.
If your hand and fingers are making it difficult for you to work, you might have carpal tunnel syndrome. The symptoms include pain in the hand and fingers, and also might include numbness and tingling. There are many risk factors for having carpal tunnel syndrome, but numerous recent reports have shown two risk factors that were previously overlooked, one being a small wrist size and another being a square wrist shape. To understand why these matter, we must understand carpal tunnel syndrome. It's actually a disease that begins deep inside the wrist, inside a confined area known as the carpal tunnel. Inside the carpal tunnel, your flexor tendons, here shown in white, are very close to the median nerve, here shown in yellow. The tendons are surrounded by a fluid-filled sheath, here shown in blue. Under certain conditions, the sheath begins to swell, and that pushes against the median nerve, and that causes the pain and other symptoms of carpal tunnel syndrome. As you can readily see, the median nerve needs enough room inside the carpal tunnel so it doesn't get compressed. From an anatomical standpoint, a wrist that has a flatter shape or more oval shape has more room inside the carpal tunnel. This puts less compression on the median nerve. In contrast, a more square-shaped wrist has less room inside the carpal tunnel and puts more pressure on the median nerve. Likewise, a more narrow wrist affords less room inside the carpal tunnel, thereby increasing the chances of compression on the median nerve. So if you do have carpal tunnel syndrome, what can you do to treat this painful and often debilitating condition? If you're thinking about having surgery for your carpal tunnel syndrome, discuss with your doctor the fact that most people are dissatisfied with their surgical results, while the overwhelming majority of people who use non-surgical therapy are very satisfied with their results. Your doctor should candidly and openly inform you of this, because those statistics are so important that the Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical options before considering surgery. Those non-surgical therapies that everyone should use start with resting your hand, splinting your hand while you sleep or night splinting, and deep tissue massage. In fact, deep tissue massage is nearly 100% effective in relieving carpal tunnel syndrome, but only if it's done daily and for a period of 2 to 4 weeks. But this isn't your everyday massage. It requires specific motions over the forearm to drain the fluid inside the carpal tunnel and to break adhesions over the tendons that cause inflammation. But you don't have to visit a therapist every day to get this treatment, because the Carpal RX will do it for you. The Carpal RX automatically produces deep tissue massage, which acts on the tendons, causing them to lose their inflammation. Surgery doesn't address this inflammation, which is why it fails so often, and why the Carpal RX is so successful. It comes with a true 100% guarantee because it targets inflammation. The Carpal RX always had and always will have a 60-day risk-free trial, which means if you're not satisfied for any reason whatsoever, you get a full unconditional refund of all of your money, including return shipping costs. If you suffer from carpal tunnel syndrome or wrist tendinitis, you have nothing to lose by trying this remarkable product. Remember, it's the only product backed with a 100% guarantee to permanently and easily get rid of carpal tunnel syndrome, wrist tendinitis, or repetitive strain injury. Learn more at carpalrx.com.